Hello, everyone. Thank you for joining us today for Thrive Health's November 2022 Grand Round Speaker Series. So before diving in and introducing our speakers, we wanted to open with a land acknowledgement. So we are hosting this session today for those of us on Pacific time from the unceded and ancestral territories of the Musqueam, Squamish, and Tsleil-Waututh nations. And we're lucky to have team members, attendees, and panelists today joining from other territories across North America. So again, welcome and welcome back. If you have previously joined us for one of these sessions, my name is Marie and I'm Manager Marketing Communications here at Thrive Health. Today's discussion will be on how the future of primary care and technology democratizes access to care. So before jumping in, just a few quick housekeeping notes, and I apologize for the alarm beeping behind me. So you'll see on your Zoom screen a Q&A tab. We ask that you please enter questions in that tab. We will answer them throughout the session. And you have the option to enter questions anonymously or with your name. We'll start with our discussion portion, and then if there are any remaining questions at the end, we will take those up during some Q&A at the end as well. And we'll be moderating the tab to make sure that every question gets answered. We are also recording this session, and we are also live streaming the session on LinkedIn. So without further ado, I will introduce our speakers and pass the mic. We are grateful to be joined today by Dr. Sapna Sriram, founder and CEO of Integra Health Center. Dr. Sapna is a proven healthcare entrepreneur, serving currently as the founder and CEO of Integra Health and bringing 15 years of award-winning experience in the medical health and wellness industry. Integra Health works with leading Canadian organizations to deliver outstanding patient experience and is on a mission to change the way healthcare is delivered in Canada. Dr. Sapna has a passion for building healthcare systems that are patient experience focused and believes in collaborative and integrative models being the key to bridging the gaps in healthcare with digital solutions. She has successfully combined private and public healthcare solutions to deliver a comprehensive and refreshing approach to patient care and corporate health and wellness. Integra Health is a proud BIPOC female-owned and operated business. In conversation with Dr. Sapna today is Amee Choksi, Thrive Health's Manager of Strategic Initiatives. Amee drives our Strategic Initiatives Department, which is a unique function within our organization focused on developing, overseeing, and managing growth strategies for pilot projects, new solutions, and channel partnerships. So without further ado, I will pass the mic to Amee to kick us off today.
Great. Thank you, Marie. Hello, everyone, and welcome once again to Thrive's 2022 Grand Round Speaker Series. Thank you for tuning in, and thank you, Dr. Sriram, for joining us. Let's begin by leveling the playing field, as paradoxical as it sounds in terms of our topic today. From your perspective as a practicing care provider yourself, what does access to care mean, and why is primary care access so important?
Well, I think right now what we all are facing across the country is just a massive shortage of access. And I think what we fundamentally don't realize is that primary access should be first and foremost something that we can all access, not just when we have emergent issues, but even just for preventative issues. And oftentimes it's even sometimes the more preventative and smaller scale issues that honestly get missed because access is just such a challenge right now in our country that it's causing so much of a burden on the community at large. And I think, when we look at sort of, what is the confines of accessing primary care, it's really just being able to know that, when you fall sick, when you have issues, you have the ability to go and just get the most bare, basic, fundamental healthcare services provided to you. But unfortunately, that's not the case. And I think even just in Ontario alone right now, pre-COVID, we had about 1.3 million Ontarians without a primary care family doctor. And that number has risen to over 1.8 million, and it's actually growing as we also see more newcomers coming to the country without access to care. And that number is only expected to get worse, not better.
Yeah, absolutely. And it's a critical issue, not just for any one of us to get access to primary care, but it's all the more widespread in terms of disparities that impede the delivery of effective care for disadvantaged patient populations. So from your experience, what do you see as the barriers to access to care, and especially for marginalized populations, such as people of color or even immigrants for that matter?
Well, absolutely. I mean, as POC ourselves, even just talking, like, I think when we look at sort of access to healthcare, I think, there are fundamentally a lot of challenges. And I think those challenges become bigger and bigger, especially as you go to more, areas where there's more diversity or more, sort of influx of certain cultural or socioeconomic groups. But even just having, for me, primary care clinics and just overall, full comprehensive clinics in downtown Toronto, we still see the access of, the barriers of getting access to care just being cultural barriers, just not really recognizing, the differences of how to approach certain things when you deal with, sort of different cultural groups. There's also just, what we find too is just how healthcare is actually received. Like when you go to seek a doctor actually changes based on your cultural background, and also just based on where, you're kind of used to sort of accessing care in a different country, and how that even comes when you come to this country and what you think you're allowed to do and not allowed to do. I think, what we also have to recognize, especially with even, when we're dealing with dealing with immigrants or refugees, even, we just need to also look at, there are mental health impacts, there are definitely barriers to, accessing care because of trust being a big issue, and not knowing if you can trust the provider that you're seeing to understand you. I think there's so many things. And I mean, obviously the most obvious one just being language barriers. And I think so much of it is just, how you display your sickness to a doctor can be very different based on, the culture or the background that you grew up in versus how you actually, would say or explain what your symptoms are to a doctor, and how that's interpreted could be very different depending on the cultural background of that doctor as well.
Yeah, absolutely. Providing culturally appropriate and competent care is, I think, a key component to minimizing the barriers immigrants and refugees face when accessing healthcare. And actually, this leads to my next question. How has digital care changed this landscape, and how is tech enabling, or for that matter, disenabling care today?
Yeah, I mean, well, we saw it during COVID, right? I think we always used to hear virtual medicine and telemedicine can enhance, access. And what we didn't really realize what that meant really wasn't until COVID, when now it's become, standard practice to be able to say, I can phone a doctor, or I could, video a doctor. But I think these advances, from COVID, there are silver linings. They've shown us that there's definitely a place for technology to really help us with digitally providing better access. I mean, right now, the conversations even that I have in the public sector around wraparound care models, really involve technology. There's a lot of great components of being able to have, or extending telehealth services across the country, especially to more rural areas or areas where it's more difficult to get access. I mean, another piece of this too that we don't always even think about is just access to transportation being such a big barrier, and how, telehealth and just access to virtual services can really help, continue to increase access, especially in a time right now where we're in such dire, resource strains. Another piece too, we talked about it even earlier today, Amee, is with mobile clinics, being able to digitally provide care, like in a mobile context, especially for those who have, issues with mobility or not being able to get that access, like we talked about. Those are just some of the few ways that I think, technology is going to be able to continue making a big impact. And I think it's definitely a low cost when you look at the magnitude of how much we're currently spending in our public sectors on healthcare. Implementing some of these, even just with like centralizing our health data records, there's just so many things that we don't realize will give stronger impact and ability to provide better care as well from a provider standpoint. That, for me on the front lines, I think I see. But I know from your side, like, what are your thoughts on the same context?
Yeah. I agree with you. I think another dimension to this, as you mentioned, transportation as being one of the big factors. And given that tech is such a big enabler, I think one of the critical questions that comes to mind to people is also a lot of this is reliant on internet. So when we talk about disadvantaged populations and maybe individuals that don't have immediate access to care in terms of a physical location, how do you see access to even digital tech being available to them, or internet for that matter, as either a barrier or an opportunity to access care?
Oh, I still think it's a huge barrier. I mean, I can even just share what we saw during COVID when certain services went virtual, even just with mental health as an example. Now that we can reach so many more people with virtual mental health services, it actually became a big barrier because there were a lot of people who could not access services like that just out of, to be honest, just safety concerns, right? Like sometimes you don't realize that, also when you look at the sort of the vulnerable, you're also not taking into consideration some of these newcomers are also facing potentially partner violence, or having family situations where they can't openly talk about their issues or can't openly be in a video with privacy. I mean, even just space sharing, there's a lot of privacy of health data that we just continue to notice that, I mean, we can't just log on anywhere and everywhere, or at least not everybody can. And I think we take those things for granted when, we look at even just you and I being able to log on, and all of our guests today being able to log on to this webinar. This is not everyone's reality. And I think, we have to realize that we've got to learn how to meet people where they are. And I think, when you look at technology, and even just when we look at sort of, how do we find models of comprehensive healthcare in other communities, I think that's a big passion for us at both, I think at Thrive and at Integra. We've got to look at how we can make things more simplified. And I think there's a place for technology when we look at that, but I also think that it doesn't just mean, log on and look at a doctor and talk to them. It really needs to meet people, at points where maybe that means it's technology in their community, where they have a place to still see someone in real life, to be able to give them that care while also being able to maybe not just focus on them getting the care in the comfort of their own home, because not everyone has comfort in their own home.
Yeah. And there is a lot of research done where care in your home environment is so much more effective than coming into brick and mortar facilities, because you're able to get treatment based on all of your other conditions in addition to your clinical profile. So they assess, doctors are able to assess your health profile, your socioeconomic profile, and really get a full picture of your health.
Mm-hmm.
And originally, digital health was intended to serve remote communities, but now we're seeing that increasing shift towards, being able to even support shortages of care providers and long wait times, and at local walk-in clinics, even for that matter, and lack of accessibility. So I'm just curious, in your experience, what are examples of some new technologies that you've seen that are enabling this kind of access to care?
Well, I think we've seen it, in some of the most ingenious ways, but also simplistic ways, where we see things like virtual pharmacy, being able to get your medications delivered to you. And again, those are just simple things that really make access to care so much more convenient. Sometimes we don't realize that, if you're a senior and you can't leave your home to pick up your prescriptions on a regular basis, just being able to have technology help you do that has been a big, added advantage. I think when we also look at even just technology, when it comes down to simple things like online booking, being able to use technology to message or interact with your clinic, interact with your providers, being able to actually, share some of your health data, so that you have access to your health data as well. Like, I think, we don't even also sometimes realize just how little access we used to have pre-COVID, when it even came down to being able to get access to your imaging results or your blood work results, and now being able to have that data transferred to you. It's very empowering. And it's also something that I think we all should have access to. Like, I think transparency in your records is really important. I think technology is also just another piece of that we've seen, especially over the last few years, become more normalized and become a little bit more accessible to more and more Canadians. Yeah.
And in addition to transparency, I think it's empowering patients to be more active participants in their own health. And to be able to, access their medical records at any time, to advocate for their own health across a series and spectrum of providers that they see over their lifetime. and help
I
maintain
think
that.
that's blue sky, right? Like, I think ultimately we should be able to have everything accessible to us, whether you're getting physiotherapy or you're getting, seen by a cardiologist, like to be able to have your own access to those reports and files, or, just even having your aftercare visit summaries being accessible to you. Like, those are just so empowering, because a lot of us, when we're in healthcare offices, I mean, we've heard of white lab coat syndrome, where your blood pressure rises and you feel really anxious when you go into a doctor's visit. But in addition to access, what we don't realize is also even just like understanding what's being told to you. You don't always absorb the information just because the doctor's talking, but it's good to be able to have information to look at, to be able to digest, versus you just going on to Google and being like, my doctor told me I have high blood pressure. Because everything else that you heard after that during that visit might have honestly been completely, over your head, because you're only hearing the diagnosis and you're starting to worry. And I think, as a parent, I've had that happen to me where, doctors told me something about my child, and I couldn't really hear everything else, even though I'm in the field and I understood everything that was happening. The comprehension sometimes is not there. So having technology can be such a great advantage with those pieces of information are available to you after your visit, so that you can actually digest the information and potentially share it with your spouse. Where in my case, I could not relay that information when my husband got home, because I honestly couldn't remember, because I was just like, oh, it just caught me off guard.
Yeah. And it all sounds great, right? To have all your information in one place, to be able to access it at any time, to share it with whichever care provider you see over the course of your lifetime. But this conversation would probably be incomplete if I don't mention privacy and security, given that that's top of mind, and patient safety is the number one aspect to consider when we talk about technology, especially in the healthcare space. And you've been on both sides. You mentioned, as a parent, when you go to see a provider for your children, but you also provide care for others. So what is your view on security and privacy when it comes to data safety and, safety of personal health information?
I think honestly, it's such a small, sort of thing that it needs to be ingrained in all care providers and all patients as well. But I think for patients, we don't always sometimes realize just how valuable personal health information is, and how, we really do need to have that information stored. You need to have the confidence to know that your information is stored. And as a provider, knowing that your information is being, shared with patients in a secure format, it is very important. And I think as much as we see, a lot of great glossy solutions that sort of come around, to be able to help improve things, we really always need to make sure that, that privacy is really something that is compliant, because, there are a lot of fundamental rights that our patients need to know about. And I think, it's also important that we as providers are making sure that our patients are having their privacy advocated for and protected, because it's literally, they're putting that in our hands. And it's something that we really as providers need to always ensure that we're investing in solutions that don't even, have to waver on that. Like I would never want to have that as being a concern.
Yeah. Actually, we just got a question along the same lines, and this is right in time. How is Integra Health's clinic model set up to improve access to care in this way?
Well, I think that's something that we've always been focused on reinventing, how we deliver care. I think, during the first 4 or 5 years, we were very much a brick and mortar, you come to the clinic, you get your services and you leave. And I think like most healthcare providers, realizing that hybrid, virtual and in-person services are really what's going to allow our patients to get better access to care in a way that meets them where they are, right? Like, I mean, we see it ourselves right now being downtown. Not everyone is downtown every day, but healthcare doesn't stop. You still need to get, your care met. And I think, not only looking at just virtual care and in-person care, but, we're constantly looking at technology on many fronts so that we can make healthcare more accessible. And, we talked a little bit about things like virtual pharmacy, and soon, we'll talk about some of the things that even we're doing with Thrive, which I think, will just continue to expand that. But, I'm a firm believer that, we need to be able to kind of look away from just, I need a family doctor, to looking towards, I need a trusted place where I can get healthcare and trusted quality healthcare, and at least in times where you can't access your primary care doctor. And I think what we've really tried to, do as much as we can is provide as much quality primary care and really allied healthcare as well to those that, currently just have so many challenges in accessing. So it's definitely, there's definitely a lot of work to continue to be done, but it's just some of the things that, we really try to look at to help our experience with our patients and in helping them get that access that they need.
Yeah, that's great. Thank you. And yes, there's always an optimal balance of technology. It can never be 100% technology or 100% brick and mortar. And I think there's the right balance is somewhere in the middle of that spectrum. This leads me to my next question. What steps does the Canadian healthcare industry need to take to continue to improve access to care? And what has the industry already done to enable quality and equality of care from your experience?
Question. Yeah, I mean, that's a great question. I mean, I definitely think that extending telehealth services is something that, at least provincially in Ontario, is something that we need to look at. I think right now, with so many people not being able to already have access, and I'm sure, I don't know how many of you are here in Ontario, but as of December 1st, they decided to actually put barriers towards certain telehealth services. And it's something that's constantly, I think, in battle in all of our provinces across the country. I think, when we look at the balance, and like you said, I mean, right, like there's hybrid healthcare. I think regardless of sort of where we are, I think we can all attest that there needs to be hybrid models, where you have access. And I think to do that, we also need to invest in things like mobile clinics. I think mobile clinics really, especially for vulnerable sectors, rural areas, just being able to have even just community-based health responsiveness, where something as simple as running, diabetes clinics, running, preventative health check clinics, running flu clinics. There's a lot of opportunity for us to really, have health sites or healthcare sites where we can actually also even run more public education. I think is really important. And I think regardless of sort of all the things and the parameters we put in place and what solutions we put in place, I think it's really important that we continue to invest in cultural responsiveness. Excuse me. I think that's a really big, thing right now. And I think, being able to provide culturally sensitive and culturally appropriate healthcare is important. But I think that also means, really getting trained and getting access and getting more resources in that area. I think just the fact already that, we are able to get more, foreign trained healthcare workers licensed quicker, I think is already one big step in being able to have a little bit of that responsiveness. But I think, again, those are just some of the things that I can think of, at least off the top of my head.
Yeah, thank you for that. One of the other things we're also along the same lines with tech that we're looking into is increasingly being able to provide services in different languages so that even the virtual component of care can be accessible in different ways.
Absolutely. And I think too, just even focusing not just on primary care is the topic of this, but I think also just looking at the supports of allied care, when we look at mental health, nutritional care, when we look at all the other allied health like supports that we have currently, integrating that as well in a collaborative sort of, digitally enhanced way is also another great way to really improve people's care and outcomes, because, instead of having responsive healthcare, we can really focus on more proactive healthcare and really being able to, put prevention back where it should be. And I think, right now we're just in crisis and everything is about being reactive. Everything is, really just focused on providing acute care. And I think if we can really sort of look at the primary model by investing a bit more in allied health, investing in prevention, we'll really also, in using technology again to that benefit of being able to spread that access with more mental health resources, more, public health resources. I just think that in itself will also take a lot of stress and burden off the primary care setting right now. And, hopefully drive a little less off the waiting times that we're seeing right now, because the waiting is literally killing our country.
Yeah. And that's actually a fantastic seg into the reason for our partnership between Integra Health and Thrive Health. It's been one of the very reasons we have started Circle to address some of these issues and take hold of a lot of these opportunities and improving the way we can provide healthcare to everyone and make it more accessible and equitable. Would you be able to share a bit more information on Circle?
Yeah, absolutely. Well, Circle is basically what we call as our digitally enabled healthcare concierge, and it's really our way of being able to provide more resources to the fundamentals where, it's looking at things like express primary care, looking at really a lot of the things that end up in emerge that shouldn't end up in emerge. And when you look at sort of, again, the limited access to things like walk-in clinics and just the limited resources that we currently have with certain community groups, looking at Circle's sort of overall encompassing approach is really about taking digital tools, really being able to provide advocacy for a patient. So, where they actually have access to their health records, where they can actually map out their own wellness goals and wellness journeys, being able to access, healthcare preventative resources where they can actually focus on their wellness, their mental health, their nutritional health, and so many other components. And when we're sort of looking at Circle, we also look a lot at, there's a lot of pressure right now for even just when we look at sort of what's the role of an employer, what's the role of our government, who can step up and really help provide more care. And I think, when we look at sort of, all the different stakeholders at play, I think there's a big responsibility and a big push right now for employers to be doing more, for the government's trying to do more, but clearly it's at a breaking point or tipping point at this point. And I what I'm really sort of excited about is that Circle is really taking the best of technology, and it's taking the best of what we call hybrid healthcare, which is virtual care and in-person care, and really trying to provide a solution of access to people where they have more resources and they have more supports to really take more care of themselves, both in the preventative mindset, but also in those times where there is an acute care issue that they can easily get addressed instead of having to really, I think we can everybody in this group can probably sort of relate to either themselves or somebody they know having gone either, chased around different clinics to try to get seen by a doctor, or ending up in emerge for something that they knew really was just so simple. I just needed this, or I just needed something really quick. And so, we're really hoping that that with the convenience of access, that we're really going to be able to provide so much more support to so many more Canadians in a meaningful way that will really change their current disadvantages when it comes down to accessing the most fundamental healthcare resources.
Yeah, I actually want to dig in a little bit more into this idea of longitudinal care and the transitions between different care providers, and a more preventative and long-term approach to care that you mentioned. What is Circle's approach and philosophy for handling those long-term relationships beyond just those one-off episodes of care?
Well, we really talk heavily around what we call a patient journey. And I think patient journeys change. We sometimes are currently dealing with one journey that's, related to a health issue or health concern that gets, resolved potentially within the year, but our health is ever evolving like we are. And I think, what I love about, Circle is really just looking at that long-term relationship with your health and wellness, and really realizing that there's going to be times in your health journey where you are more acute, and there's going to be times in your health journey where you can be a little bit more proactive, be a little healthier, eat a little bit better, move a little bit more, and really just, recognizing that, there's just so much that we deal with on a daily basis, and, really trying to be there to support things like your mental health, your overall mindset, your wellness, and having the ability to have access to your health in our patient journeys, but also being able to access things like your visit summaries, your labs, your imaging, just being able to have a centralized place where you can access your healthcare, and seeing it all change over time. It's to us, I think that's just really what's so special about Circle, right? It's just about the fact that it is full circle care. You are going to have different needs and goals and desires along your health journey, along your life, and we're here to sort of provide that support along the way.
Yeah, and even to be able to get more guidance in terms of what care you should seek at any point.
We still don't know. And so many people still don't know. I can't tell you how many times people will come in and say, I need to see a doctor. Well, why? And a lot of the times it's something that, just again, we just are framed to realize that we need to see a doctor for everything. And that's part of the problem, right? A lot of the times we don't unlock allied health enough to realize that, maybe you actually need to see a physiotherapist if you hurt your back, who can diagnose you, who can create a treatment, who can coordinate imaging, and also potentially have you be seen by a primary care provider if something additional is needed. But it's exactly that. I think a lot of the times we feel stuck and we automatically, we all think about our primary care, and Circle is also there to help you understand what your health resources are, understand what your needs might be, and actually be able to sort of point you in directions that you might not have really realized is the answer. And sometimes waiting for a doctor could be waiting, you're spending a lot of time just waiting to get access to something that you could have started a lot earlier and gotten better a lot quicker.
Yeah. And touching on your point about even just getting credible guidance, so Circle does offer services both virtually and in person. How are Circle's virtual care services different from other solutions that we see in the market in terms of virtual care?
Oh, I love this one. So, so I don't know how many people here have used virtual, sort of services, but a lot of the times what we want to take away and what we want to keep with Circle is a bit of that community. We want to know that, we're trying to keep with a lot of the time when you use a virtual service out of urgency or need, you don't really know who you're seeing. You don't really know sort of, what that follow-up looks like. Where do you take that information next? And I think what, Circle's trying to do is it's actually trying to consolidate all of your services and your healthcare into a centralized platform. So as an example, you might need express care for a matter, and, you get a prescription. That information is now stored on your app so that, if you, for example, now call our concierge nurse, in the middle of the night, and something has gotten worse, that information is not just going into the abyss. It's where you have to relay that information again to your provider. That information is actually all put in there so that you can actually get follow-up from the same provider. And our goal is to have the sort of care being met by a virtual provider and an in-person provider that could potentially be the same person. So, really being followed along for a lot of things as well. Because a lot of the times when you see a virtual provider, you're not going to see them even the second time virtually. And we know that virtual is a great benefit for a lot of things, but unfortunately, what's really happening right now with a lot of virtual services is that they're still directing you to have to go in because you need to get blood work, or you need to get, your urine sampled, or you need to get potentially more follow-up or other investigations that need to be done in person. And the benefit of having Circle is that if that's told to you virtually, you can then come in to an actual Circle clinic and actually get that care assessed at Integra, and have it all still managed and followed along from start to finish, instead of you having to find a different place to go to next.
Thank you for that. Yeah, and that's one of the things I love about Circle as well, where it's not just virtual care, where it's a one-off, you schedule an appointment with someone, but it's more just healthcare enabled by technology for a full picture of your health and along your care journey.
Exactly.
All right, we're getting in some questions from the audience. The first question is, how much is the current fee-for-service model in the way of digital adoption and preventative care?
How much is the current fee-for-service model? Like, I'm not sure I fully understand it in terms of digital adoption and preventative care. I mean, right now, our fee-for-service model, like in terms of, just looking at digital adoption, I mean, they've already changed it in Ontario to have limitations on what you can and can't see virtually or digitally, I should say, but I'm not sure I fully understand that question, unless, do you interpret it any differently?
I believe just in terms of reimbursements for digital adoption, for digital technology and care or value-based care, how does the current fee-for-service model enable that? Or
yeah, I think that's a tough one. I think for me, I can speak to just sort of, right now, fee for service, there's limitations with your provider. It really depends on where your provider operates out of, and what the government or the provincial government mandates as being covered by the provincial system, whether video or phone are sort of like constraints. And also even just depending on where you are, if you're somebody that's never seen that provider before, you may not be eligible now, depending on where you live, to actually even get virtual care. So there's quite a little bit of change, and a lot of it's kind of happening literally as we speak right now across different provinces. So yeah, it's a tough one.
Okay, thank you. Our second question is a two-part question. I believe this is along the lines of circle. So first part, how can I, as an employee, advocate that this is an important service for the health and wellness of our organization? And I can wait for the second part till later. But what services are available if I'm remote or unable to come into the examination room setting?
Okay. Well, I think the first one, I mean, we have an amazing employee wellness playbook that just speaks to, it's actually on the website. I don't know if we can put the exact link, but it is, I see that the website has been posted on the chat group here. But, there's a lot of, great data that supports, just how much an organization should step up for their employees. And I think, first and foremost, getting this in front of HR is really important. I think it's an important topic that needs to be discussed. Just even the conversations that, even Amee and I have had with different employers. Every employer has a different demographic of, employees. Like they have just different, sort of goals, depending on their age average and, depending on sort of even their background of employees. And so I think it's just really important that, if you want to advocate for this, I think the first step is really just, sort of sharing the importance of it to your HR and sort of, allowing the data to speak for itself. I think, with our playbooks and posted, there's just so much. And I think, even your HR are people as well. And I think they'll all realize as well just how much healthcare has become an increasing burden. And I think, just knowing that, I think a lot of companies are really trying to put culture at the forefront of their organization. And I think a healthy workforce is a happy workforce, which means it's a workforce that's going to stay and stay engaged and stay productive. And I think the cost of going off, or the cost of somebody leaving, is so much more expensive than just investing in health and wellness as a preventative strategy to keep your employees happy and healthy.
Perfect. Thank you for that. And then the second part of the question was, what services are available if I'm remote or unable to come into the examination room setting?
Yeah, so that's the whole point of Circle, right? It's still meeting you where you are. So, Circle Express Care can still be accessed virtually. Virtual pharmacy is still accessible to you. Our virtual resource library is still going to be fully accessible on the app. So there's so much that you can still take part in. I think even the nurse concierge services, the referral 360 program, there's quite a lot. What our intentions are is that knowing that you still have a place to come to get your healthcare. I think knowing that you have that access is still important, but knowing that you can't participate just because your location is not close by doesn't prevent you from still being greatly benefited from a program like this.
Great, thank you. We do have a few minutes left, so I'm not sure if there's any more questions from the group. Maybe I'll give folks a few more minutes, but as we lead towards wrapping up today's great session, I'm curious to hear from you. What do you see as the future of access to care in an ideal world? And where do you see this evolving to?
I think in an ideal world, I think, there's a lot of debate around sort of what we see as healthcare, but I really would just love to have, our emergency rooms in our hospitals really there for the people who need to be in the emergency in the hospitals. I would love to sort of have our doctors and our nurses not burnt out. So having tools that not only make delivering healthcare more seamless, but also having, just solutions inclusively available to more people so that they can get the fundamental, healthcare that they need, not just when they're acute, but also, in the preventative standpoint where they can get access to just, things that they can do to stay healthy. I think that is, for me, I think a blue sky. I think just realizing just how much, access makes people angry, and just how much it impacts their overall health. It's making us sicker, not just because our health concern is getting worse, but is literally frustrating so many Canadians to the point where it's making them sick. So we really need to sort of, figure out a more sustainable solution, because clearly, we don't have an abundance of doctors graduating from, the handful of medical schools that we have in Canada. And, even though we're bringing on more foreign trained professionals, it's still not enough. And I think, we really need to sort of look at how technology, how other stakeholders like insurances and, employers can all get involved in this problem. I don't think it needs to be a government only situation. I think there really needs to be more people joining forces. I think collaboration is key in this situation. And I think we all have a role to play. I mean, providers have a role to play. I think technology can really be a huge asset. And I just think that more people need to get involved to really help this crisis, and for all of us to really get through this so that we can all just get back to getting what's fundamentally a right, which is getting access to healthcare.
Yeah. And it's this notion of integrated care that has a lot of stakeholders that would have to partner towards to make this really valuable for the patient, and for the patient to actually, be healthy in a true sense rather than just trying to cope.
Right.
And it takes the whole meaning of wellness to a whole different level. So
I think we talk a lot about the wellness piece, but we still practice it so siloed. And we see it in our clinics. Like, you see doctors' offices, you see physio offices, and that's a big part of Integra is, when you collaborate healthcare and you have more access, it's more convenient. You have everybody there advocating for you. You reduce communication barriers. You increase patient outcomes. And I think integration is really, something that with technology, hopefully we can also make better across the country as well.
Yeah, absolutely. All right, we have a couple of more questions from the audience. Are there any scenarios or services where Circle resources come to me on site?
Yeah, talk to us. Message us and we can definitely see what we can do. I don't really.
But yes, there's a lot more information on our website, but the Integra team has a lot of expertise. We're doing a lot of workshops that are custom built for organizations. And these can be offered both virtually as well as in person. So come talk to us. Next question. Along the lines of the last question, do you see any opportunities to leverage technology to support marginalized communities? I believe we've touched on this a bit before.
We did. Yeah.
Are there any plans to offer dental services? Because this it is a critical part of healthcare that often gets overlooked.
Yeah, at healthcare and also, dental care, but also even vision care. I think those are sort of for us, like all things that we're looking to enroll as a full comprehensive approach. I mean, this is definitely something that is all interconnected. And I think definitely part of our core, vision and strategy to really, integrate full healthcare over the coming time and in the near future, for sure.
Sounds great. Thank you. All right. Seems like, okay, I've covered all the questions. Okay, that wraps up our time for today. This has been an absolutely wonderful discussion. Thank you so much, Dr. Sriram, for your time, for your insights, and for your commitment to improving the delivery of healthcare in Canada and beyond in the coming years. Thank you to our audience for joining us and submitting great questions. And a special thanks to the Thrive team for all the behind the scenes work that goes into putting events like this together. The webinar will be available soon on our website, and we will see you at our next Grand Rounds. Enjoy the rest of your week, everyone.
Thank you.
Thank
Thanks,
you.
everyone.
Bye-bye.
Bye.